for coming and giving us your time. I'm Jennifer Farrow, and I'm a child find early childhood special ed teacher. And many of you know I was itinerant for about 5 years, some different roles. And Renee and I both work on Child Find, and we were given the opportunity to go to some trainings last year for Pyramid Plus. And I know a lot of you actually had that training this spring, which was great because Renee and I volunteered our time. So this is a community overview presentation they ask us to complete for different community partners or people that are interested. And some of you have not had this training in the past, but a lot of the material we're going to go over, we have a lot of material over here. This stuff you've seen, it's stuff from the Taxi website and the Shuffle website, which I know a lot of you use every day when you're doing inclusionary practices with the children that you serve. So it might seem a little bit repetitive what I'm talking about, and I just wanted to warn you on that. And you might, as I'm talking, have a question, and the next slide will explain that. So hopefully this will go smoothly. If you have any questions, please ask. And a couple of people will be joining us. And the pointer, great. Because I use my hands a lot like this. And we did give you some handouts. We gave you a evaluation to fill at the end for me. And this is a whole packet. There's a pyramid on it, which I know you guys have been using a lot with your trainings with the ECE department and the staff there. And we'll talk a lot about the pyramid model and what the difference between the pyramid model and Pyramid Plus is. And this has a lot of different things that we'll refer to, and Renee will back me up on things that I forget while I'm speaking. So again, this is the Pyramid Plus community overview training. Renee.
Oh, sorry.
So hopefully after this presentation you will understand the history and the role of the Pyramid Plus Center, which is what Renee and I are affiliated with. The tiered supports available for scale up and sustainability in communities, which will relate a lot back to the pyramid, where we are, where we're going in DPS, and the community at large, which you guys are a big part of already, and the basic content and process of the Pyramid Plus approach. One of the other things that my colleague did was she put in some information that we've actually, the coaching we've actually been doing this year. So we have some videos I think you guys will kind of find interesting. I think you guys have seen us out in the school sometimes, and I'm like, what are they doing out here? Kind of explain that a little further, much more so than the presentation really goes into. We want to thank our Pyramid Plus funders, the Department of Human Services, Division of Child Care, Division of Developmental Disabilities, Early Intervention Program Part C. There are parts of it that I have to read verbatim, so
Is it okay if I
bear with me. And then the local community funders and supporters. For this training, we actually have had financial support from the Early Education Department at DPS. The Mile High United Way Fund funded a lot of the trainings that were done in the springtime. Colorado Preschool Project, the Denver Preschool Project, and the Denver Early Childhood Council. The overall goal is to ensure high fidelity implementation. That you'll hear again and again. And I'm going to try not to read verbatim because I know we can all read. But I'll try to kind of hit the highlights. The pyramid model for promoting social and emotional competency of infants and young children is part of the Shuffle and the Taxi websites. You guys have all used those, correct?
Mm-hmm. And then
I'm not thinking
the website addresses are
down there in case you haven't,
right
but I know through your work this year you've all used those in the past. I'm just, like I said, this presentation is an overview for a lot of people who don't know what that is. So, and also is part of the Special Quest Birth to 5 approach to early childhood inclusion, which you will see in the building blocks and the leaf, which I know you guys are all familiar with. I know you've used the Special Quest videos in your presentations this year at ECE, correct? Right, I'm correct in thinking that. Next. The Pyramid Plus Center objectives, the objectives of the center is to support the state collaboration and the interagency teams to provide training and technical assistance and to establish rigorous evaluations and evaluation systems.
Sorry.
My esteemed colleague would stop moving the paper.
Okay, I won't move it anymore.
Okay, thank you. Next.
But I don't know how to get that.
It's all right. So here's a copy of the pyramid, which you guys all have in front of you. This is a little bit out of order. I kind of just wanted to refer to it now. As you know, we have Tier 1, Tier 2, Tier 3, which we have all worked with. Like I said, I don't feel like I need to go into a lot of detail for this, but the pyramid model and the pyramid plus approach are different, and we'll go into that a little more at a different slide. Thank you. This is some data. Now we're going to really go over some of the data we have from the national level. It really relates back to the approach and the reason why we want to do this in Colorado and throughout the country is educators in early childhood programs report that the graduates are least likely to be prepared to work with children with persistently challenging behavior, which I think is a fascinating fact. That's from about 9 years ago, is that even though people are going through the early childhood special ed program, the professors feel that is dealing with challenging behaviors is the thing they're least likely to have, which I think is interesting talking to a bunch of early childhood special ed teachers. I felt like a lot of my personal experience I got on the job, that I had the classes, but sometimes unless I had a really intensive student teaching, which I know Aiden did, because she worked with us in our student teaching, and we had some very intensive children in that classroom,
yes.
And she had to learn on the job. So do you guys feel that is kind of the same way, as that maybe a lot of your stuff you've learned how to deal with children with persistent behavioral issues has been on the job more so in your...
And it's not just early, and they're also talking about just early childhood education, regular teachers.
Regular teachers as well, which I think, yes, I mean, exactly. I think a lot of, I turn myself, a lot of them are like, what? You're like, well, not all children sit all day long, and I think that's something that's really been, lacking in our education field as far as, at least in Colorado, and it seems that throughout the whole country. Preschool children are 3 times more likely to be expelled than children in grades K through 12. Does that shock anybody? I know we talked about the reasoning behind that. Some of it is because preschool is not mandated, and a lot of them are private. They can kick them out. Very interesting. Yeah. And it's okay. And then one of the things I think that data, we talk about like money, because it always comes down to money and the funding. In Colorado, it costs $433 for 1 year of mental health consult, so kind of like preventative services, where once they're in a foster home, it's $1,500, $760 for 2 days, it's psychiatric, and $3,000 for 2 weeks. So wouldn't our money be better spent doing some prevention, doing some social, emotional training in the classroom? And in Colorado, this goes back to Colorado, 10 in every 10,000 children under the age of 6 are removed from early care education settings for behavioral issues. And 21% of Colorado's parents have concerns about their child's emotions, concentration, behavior, or getting along with others. So 1 in 5. Of these parents, 80% have never accessed counseling. People have concerns, but never really went to Child Find or asked people or went to any kind of counseling about it.
Or there's not resources available.
Or the money's not available. This is one of my, blows my mind. In Colorado, 350,000 children under the age of 6, 31,000 are estimated to have serious emotional disturbances. Approximately 4,000 of the 31,000 of these children received mental health services throughout Colorado's public mental health system. It's about 1%. So only about 1% actually receive services, but it sounds like 10% might need services. Kat, any questions?
Yeah, I'm wondering, is that, what does that look like in the rest of the population? I mean, that's a high, is that a high number to have emotional disturbances with such a high percentage? Do we?
I mean, I just researched this data for the Colorado. I'm assuming I mean, I could probably find it, I could find that out, but I think it's pretty similar nationwide.
I think it's pretty similar.
Okay, and then not just Colorado, but like with the adult population or the overall population?
I think with overall it goes down. I think it's because the under age of 6 is not mandated.
Uh-huh.
I think that's where the concern is sometimes, is that
Yeah.
we are not mandated under, well, and here in Colorado, I'm in kindergarten, so I think you see a lot of issues. People don't know how to get services, don't know what's going on, so please have a seat. There's some papers up front too. Thank you.
So, I mean, what we're saying, we all know, because we're all in early childhood, that early intervention is the key.
Yeah.
But we're,
And there's a big need for it, obviously.
They're going to be here. These people are showing up as adults, as teenagers, as kids, you know what I mean? And they've never received services
think about it. And
when it was most effective.
Right, and 10% need it and 1% are getting it. That's a little scary. I think it's why we're having so many issues in our ECE classrooms. And the ECE teachers don't feel like they've been trained in it. I mean, that's, you know.
Well, and I think when you consider that number, like, think of how many kids we've had to do social emotional coaching on.
Oh, yeah.
It's a huge number. So
Huge
that number
number.
doesn't seem so high when you think about it that way.
At least, there's at least
I agree.
one or two children
Children
in every
classroom,
classroom that
yeah.
need individualized
Yeah.
attention.
In some classes, I have a bunch of them.
And then some of the research too, children with disabilities are 4 to 5 times more likely to have social emotional delays than children without disabilities. And early persistent difficulties in social development tend to be long-lasting, require more intensive services and resources over time. So again, early intervention. This was a quote Renee came up with. It kind of summarizes everything. Moreover, when challenging behavior of young children is not addressed in a timely way, the future likelihood increases for poor academic outcomes, peer rejection, adult mental health concerns, etc. Early intervention.
Social emotional competency is the #1 predictor of academic success
Yep.
in first grade. #1 predictor.
And I
Which is
think
what-
Early
the
social
problem that we're seeing is that children get into kindergarten and they're expecting to just do pure academics, and a lot of people don't have time
Yeah.
or energy to focus on the social emotional behaviors of the students. They expect them to function, be ready to read, and do all of that. And because so many of our kids don't get preschool,
Yep.
there's
Right. And it added to the GPS part of it, and I know
yes.
you probably know too. We used to do second step.
Oh,
And
yeah.
and now some teachers do that, but it's not mandated anymore. So we do not follow, tell me if I'm not correct, a social emotional program at Denver Public Schools.
Do we have them available though, like the second step?
No, I mean, I got one from Whittier or
I
something.
think you can check it out at the IRC.
I mean, certain schools have one, I know,
Yeah.
Bradley
PBS,
has one.
yes.
So I know that they're all around, yeah.
But it's not a universal approach yet, which is what we're saying. This is so important that we do something.
Well, and it's kind of ironic too, because in DPS, some teachers are really skilled at doing social emotional and really value it, where other teachers are just pushing the academics so much at this age that they're actually contributing to social emotional.
Which is why I was-
And then that
Yes.
they don't have time for it. But
Mhm.
if you don't do that, then you're not really gonna have time
So
for it.
what we're seeing is there's a need.
For consistency training across
We
EC
need
classes
this.
and early childhood programs, which you guys have been working on, and because we're going to get to the whole collaboration with ECE. We're really trying to push this. You know, this is our need,
We're just in the very beginning stages.
as you know.
Oh, do you want?
It's fine now.
Okay, these are
So these are some DPS stats that we just thought were kind of interesting that we pulled from the websites as well. 30% of children in poverty have social, emotional issues, and 72% of students in DPS live in poverty.
That's based on free
That's
and reduced
huge numbers. What, we
lunch.
have 85,000 now? And so what are you thinking? Let's say 60,000 live in poverty, so we'll say 20%. So 20,000 have social emotional. I mean, that is, this is a whole population, it's not just preschool.
So I don't have the exact number, but we're talking just about Colorado, so that number is gonna be even higher in Denver
Yeah.
because of the concentration
Of poverty, I think. 2011, 2012, 14,000 students, children were suspended. This is not just preschool, this is all over in DPS.
I didn't know how to get just.
We didn't have those numbers, and I didn't want to ask EC for them. 2,000 dropouts reported, which is almost double the state average. We had double the state average, everybody else. And on-time graduation rate is at 58%, which is a huge improvement, if any of you know.
It is, yeah.
Been at DPS for a while, but it kind of shows where we're going and how, you know, probably those preschool are gonna infect that, you know, to our overall numbers. Next. So, from pyramid model to pyramid plus center. So, I'm gonna go over this it's kind of interesting, but so you guys have kind of an overview, because I know a lot of you, again, have been to the training already. 2001, the Head Start and Child Care Bureaus funded the CEFL and TAXI. So both of these were funded through Head Start programs, okay? And in 2005, Colorado selected a CEFL model state. So there was Colorado, I get this wrong, Colorado, Florida, Virginia, somewhere else, Indiana, I think it was, that were the 4 states. 2006, 2007, they trained 350 people, and 13 coaches trained, and 3 demonstration sites were founded in Colorado. We have 4 now, we'll get to that in a little bit. In 2008, Colorado selected a Special Quest interagency state team, established trainers, and built upon a network of programs and communities. Janine Coleman was part of this. She was part of Special Quest in the whole trainings they initially did.
Can everybody see that? It's kind of crooked.
Next. So then 2008-2009, the Partnership for Families and Children, funded by the Buell Foundation, to continue support of Pyramid. And then the Pyramid and Special Quest team members proposed a state center to combine professional development, scale up what they're doing, and sustain the work statewide. And then there was a grant issued to UCD to support child care development disabilities, Part C, and behavioral health. 2009 was Pyramid Plus. So Pyramid Plus was everything plus Special Quest in inclusive settings.
Yes.
So if you hear about pyramid model doesn't include the inclusive settings. So that's why Pyramid Plus is different. People get kind of confused about that. You hear about pyramid model, this is Pyramid Plus, which goes back to having the inclusive environment. And then CDE was awarded a 5-year grant in the Office of Special Ed that supports pyramid model work in preschools for children with disabilities.
I'm not going to touch it anymore.
Next. Sorry. Yeah, don't touch that anymore. 2010, Pyramid Plus received a grant from the Colorado Health Foundation. In 2011, Pyramid Plus and Division of Child Welfare partnered on a community sustainability project. In 2012, Pyramid Plus received funding from the Temple Buell Foundation and Mile High United Way, which many of you went to the training. So it kind of gives you the overall history of the pyramid model and Pyramid Plus in Colorado. So, community history of pyramid work. This is how DPS is working with the pyramid model. So there have been 14 people trained in Denver Public Schools. 14 are currently to be trained. And I think we wrote this when you guys were going through training.
Yes.
There are currently 2 people, Renee and myself, who are in the certification process to become certified coaches, and then one who is Sherry is in the process to become a certified trainer. One participates on a leadership team with the Denver Early Childhood Council to ensure community and interagency collaboration. Is that Sherry or is that Miss Janine Coleman? Are you working with the Denver Early Childhood?
I am.
Okay, I wasn't sure. And then, so 2 classrooms are implementing the Pyramid Plus model, that is Molly Walsh's room and Mariah Michaels. Those are our people that we are coaching this year. And hopefully 2 more will attend the Summer Institute to also start the certification process. So the initial goal, and I know we said hopefully, was that Molly, Mariah, and some other people that have been trained in 18 hours would then go this summer. And I know with the turnover going on at DPS, we're kind of waiting to see what happens. But it sounds like those of you that know Robert Francham Allen, he is actually taking that by the horn, and it's going to happen.
So if you're interested, if you've been through the initial training and you're interested, you should verbalize that to him, because right now we don't have
We
our
just found this
leader.
out today.
You know, we don't have our leader that knew who wanted to do it. So
And part of becoming a certified trainer or certified coach is you have to go to a week in Breckenridge in the summer. Boo-hoo.
Yeah.
It actually is really fun. It's a lot of work, but those are our goals to then become a coach or trainer. So yeah, we'll talk about it later. The Pyramid Plus Center values. This is what the Pyramid Plus Center. This is their values. They leverage technical assistance based on available evidence and be affordable, feasible, acceptable, effective across diverse populations, children, families.
sorry, Lori.